So there's several suprahyoid muscles that you need to be able to identify in the laboratory. They end up being the digastric muscle, the posterior belly and the anterior belly, the stylohyoid, the geniohyoid, and the mylohyoid. We're going to discuss their attachment points and their innervation. Essentially, they're all responsible in some way for raising the hyoid bone. Okay? So the first one we're going to look at is this guy here, which ends up attaching to the medial surface of the mastoid process, right back here, coming down, and it inserts into its common tendon. Okay? This is the posterior belly of digastric. Posterior belly of digastric is innervated by facial nerve, cranial nerve number 7. The anterior belly of digastric essentially goes from the common tendon and into the digastric fossa underneath here on the underside of the mandible, and it's innervated by V3. Let me see if I can quickly find you another example of what the anterior belly of digastric looks like. So here, we have the posterior belly of digastric. Going anteriorly, we have the common tendon, and then it loops around and becomes the anterior belly of digastric here, where it inserts into the digastric fossa on the underside of the mandible, innervated by V3. Next, we have the stylohyoid muscle, which originates from the styloid process being right here. This muscle fiber actually is usually pinned down like this, and will come down, and it forks over the intermediate tendon or the common tendon of the digastric and pushes that onto the hyoid bone. And if you can feel for the hyoid bone is actually right here. So it would be coming down right onto the hyoid bone, like right there. The stylohyoid muscle is innervated by facial nerve, cranial nerve number 7. The other two muscles that are the suprahyoid muscles, one is this muscle here. It's the geniohyoid. Goes from the inferior genial spines into the hyoid bone. The geniohyoid is innervated by cervical spinal nerve number 1. And lastly, you have this thinner muscle here, which makes up the floor of the mouth. It attaches to the mylohyoid line of the mandible and inserts into its median raphe or midline raphe, and also inserts into the hyoid bone. And as I said, this creates the floor of the skull or of the mouth, and it is innervated by V3. So in review of innervation, you have the geniohyoid, innervated by cervical spinal nerve number 1, C1. You have the mylohyoid muscle, which is innervated by V3. When we looked at the other specimen here, the anterior belly of digastric, also innervated by V3. Then, the posterior belly of digastric, innervated by cranial nerve number 7, facial, and also the stylohyoid is innervated by cranial nerve number 7, facial nerve. Attached to this review, I'm also going to show you the muscles of the pharynx. So if we're looking at the medial side of the parasagittal heads, and we know that this wall of muscle here, that ends up attaching or resting upon the vertebral column, these make up the constrictor muscles, and at the level of C6, it becomes the esophagus. Superiorly, we know that the superior constrictor muscle attaches to the pharyngeal tubercle of the occipital bone. The pharyngeal or muscles of the pharynx, the constrictor muscles, are broken into your superior, your middle, and your inferior, depending on where they insert into. Okay? The pharyngeal raphe will go all the way down from the pharyngeal tubercle and run into the area where the constrictor muscles become the esophagus. The superior constrictor muscle will originate from, in part to the pharyngeal tubercle, the pharyngeal raphe, and will insert into the pterygomandibular raphe. The pterygomandibular raphe is what originates at the hamulus of the medial pterygoid plate and inserts into the back of the mylohyoid line. Then you have the middle constrictor, which would be in this area here. And the middle constrictor will originate from the pharyngeal raphe and insert into the hyoid bone, which is right here. Okay? So the muscles of the middle constrictor insert into the superior surface of the hyoid bone. And then the inferior constrictor will originate from the pharyngeal raphe and insert into the oblique line of the thyroid cartilage, which is this being the thyroid cartilage right here. Okay? And so what it does is it creates this open area within the pharynx at the level of C6 that closes off, and it becomes the esophagus. Also worth noting, something that I didn't bring up to you before, but a muscle that I would like to show you, is this muscle here, which also, I'm bringing it up because I just talked about the pterygomandibular raphe, and you're going to have the pterygomandibular raphe where the superior constrictor is going to insert into. And so it inserts into the pterygomandibular raphe on the pterygomandibular raphe's posterior surface. And then on the anterior surface of the pterygomandibular raphe, you're going to have this muscle here, which inserts into orbicularis oris. And this is your the trumpeter's muscle or the suck and blow muscle. This is the buccinator. And usually diagnostic of the buccinator, you'll see the parotid duct piercing it, but we don't see that on this guy.